Hey everyone, real quick before we start this episode, I just wanted to pop on here and say that we recorded this episode with Dr. Alexis Wilbert in May of 2024. It is now September 2025 when we're launching this. We had plans for a while to relaunch our podcast, so I was kind of collecting a few different episodes with the intention of restarting it before we ended up actually restarting it. But I really like this episode. Alexis is absolutely amazing. She has lots of knowledge on mental health, understanding and treating disordered eating and body image issues. And we talk about the role of rigidity and control in mental health, and just also the importance of therapy and support groups. We had a support group for runners that we were having Alexis lead at the time of the recording, and we no longer do that right now. Eventually, there was just a low local interest, but if this episode launching drums up more interest, definitely reach out. I'm sure that she'd be happy to restart something like that. But yeah, enjoy. Super excited to have Alexis Wilbert on here today.
All right.
Alexis, hello. Thanks for joining me.
Of course. Happy to be here.
Alexis is a doctor of psychology, and she is a runner herself, which, as a running physical therapist, I think something running my own business for a while, something that I've really been looking for is other healthcare providers to work with and team up with who also are runners themselves. Because I think most of our clients would agree, um, knowing or being a runner yourself, I think is necessary to truly fully help runners, both in terms of the more physical but also mental side of things as well. So I am super excited to dig into a conversation with you and share some of your expertise with our community. I think first, just so everyone knows, you can find Alexis on our website, which is dralexiswilbert.com. And she specializes in the treatment of eating disorders, negative body image, perfectionism, anxiety, all stuff that we are hoping to dig into today. But yeah, Alexis, if you maybe want to just start with a little bit about how your practice works. How do people reach out to you? Where can people live and still work with you? And then we can kind of dig into some of those topics.
Yeah. Well, first off, thank you so much for having me because obviously I love this community so much being part of it, but it's also kind of a sub niche for me in terms of my clinical practice. And I love working with athletes, but runners in particular, because as you said, it's I think it does benefit the relationship for me to know what people are going through, whether it's regards to running or not. But if running is a big part of your life, I think there's some commonality there, and it can be helpful to have somebody that understands that. So, yeah, I do my practice entirely telehealth at this point. I do have a couple of walking therapy clients who just prefer to be outside, but for the most part, it's telehealth. And that actually started with even before the pandemic because I moved to Maine and from Colorado, and I kept a couple of clients from Colorado. So then when the pandemic happened, everybody switched to telehealth. And I have just found the ease of access for my clients and myself is so wonderful. And also the therapeutic relationship can still be built really well. So I love it. My clients love it, and it works great. Um, I would say that how people find me, it depends on the location, but a lot of Maine people know me as kind of an eating disorder specialist. But I have clients throughout the country. Fortunately, again, with the pandemic, institution was created called SciPac, which is basically allows me to practice in whichever states are part of this institution. And right now we're up to, I think, about 40, 42. So it's the majority of the country. I can see clients through telehealth. So I feel really fortunate to be able to do that.
Yeah, for sure. I think before moving to Maine, was that when you were working in an eating disorder clinic?
Yes, so I have a long history. I worked in an eating disorder clinic. I've worked in college counseling centers, and there I did actually specify working with a lot of the athletes and a lot of the eating disorder population of the college campuses. That was both University of Denver and Colorado College, and then had my private practice there as well, but worked at Eating Disorder Center of Denver and La Luna Center, which are two eating disorder treatment facilities out in Colorado.
And did you start your own business when you moved here, or was that already going a little bit in
It
Colorado?
was I had started it about 3 months before we moved, so it was kind of an unexpected move, but something we had wanted to do since I'm from here and my family is here. But we got an opportunity and took it, and so just kept the ball rolling once we moved.
I feel like probably in general, people are more accepting probably of telehealth in your niche than doing like physical therapy telehealth. But we do it
Yeah,
all the time. But it's certainly for us, it definitely has to be like the right type of diagnosis for people, like a tendinopathy or a stress fracture. Like generally, if it's pretty straightforward, we can do it via telehealth. If there's a little more like
right.
differential diagnosing, it's definitely a little bit harder, not being in person. Um,
Yeah.
but that's great. Let's
Yeah.
let's dig into it. I think starting like specifically, I mean, a lot of what we'll be talking about is related to runners, but I think um, starting out just talking about like some of the challenges that you see in terms of people's relationship with running, both from like yeah positive and negative standpoint. I feel like we see people
Yeah.
all the time with a really healthy relationship with running, but certainly I feel like a lot of runners it might struggle with keeping it healthy sometimes.
Yeah, totally. I think so. I mean, overwhelming evidence, research backed, that running can have a really positive effect on mental health. They've done studies to show that it helps with anxiety and depressive symptoms. So, to put that out there first, this is not me saying like, oh, if you start running that, or if you are running, you automatically have a negative relationship with it, because it is really beneficial for mental health. And I think that it can cross the line from being beneficial to being maybe a hyper focus or a fixation or an obsession, even for some people. Um, and I think some people can also develop some rigidity around running of, when runs need to happen, how far they need to go, those kinds of things. We've all seen slash been self-disclosure the person who like looks at their watch and is like, oh, I've got 10th of a mile left, I'm still going to do another lap in the neighborhood or something. So I think that that's a commonality too. And so it can, there's varying degrees of something like that versus, oh no, I need to run X amount of miles today, and if I don't, then I can't like eat my food normally, or I like, it's almost like I failed, or it's a punishment in some way, or some criticism. So that's where you want to just be kind of mindful of what function is running serving for you.
I've heard you previously talk about like your I think you described it as like your relationship with running,
Hmm.
and like do you know where I'm going with that question? Uh,
Yeah, like how is the relationship with running, or what function does it serve?
the function, yes, that was the word.
Yes. Yep.
Can you touch a
Yeah.
little bit about that on that?
Yeah, absolutely. So, when we think about running in our lives, I often ask the question, or any exercise really, but like, what function does it serve for you? So a lot of times people will be like, oh, it's my stress reliever. Like I have to run. It's how I get, it's how I clear my mind, or how I think things through, or um, and that can be a really positive thing. If it's your only thing, if you have an injury, then what happens? Right? Like if that's your only way of clearing your mind, and then you get a stress fracture, or you tear something, or even something small where you only have to take a few days off, that can still be really tough for people. So I think keeping in mind that the function of running can be a really great thing for mental health. And if it's your only tool in your toolbox, that's where we're going to run into problems.
We try to whenever we talk to someone for the first time, we try to like just kind of understand why they do their activities, and most people being runners that we work with, and I'd say at least 75% of the time they say it's like their main stress reliever. Other things might be like they do it for the social component, or there are people that are like, I do it because I'm like good at it or competitive, like I want to be competitive with either other people or myself. um, but I think most people have some amount of that, like do it for stress relieving. So I guess I'm sure you see that probably in most of your clients, but what do you have specific like recommendations around? I know it's a large topic, but common things that you'll recommend to people when they're struggling with an injury, especially, or trying to not get injured because of that.
Yeah. Well, I think diversity is important. And there's something really unique and special about running that is different than, I would say, a lot of other cardiovascular sports, even biking, or elliptical or things like that. There is something really special about it. And so it's hard because we might not be able to replace it exactly, but then we want to think about what are the components that you really love about it. So if somebody said, well, I really love that it's also social. Okay, well, how else can you meet up with people that would get you that social connection? Um, and, if it's like, oh, it's how I get my stress out. All right. Well, if you have, like a torn hamstring or something, like maybe you get like a punching bag or something to get some physical angst or just some physicality going, because I think that that's important. So we just have to look at the different functions that it serves, and it's going to be unique to each person. But finding the things that will be right for that fit. A lot of times, I think, unfortunately, people get told, like, okay, we need to do yoga and you need to be slowing down. And for somebody who's used to doing interval training or long runs, like, yes, yoga is wonderful and has its place, but we're comparing apples and oranges here. So yoga is not going to take the place of a long run on Sunday. So how do we get that? It's almost like a dopamine fix or some kind of that you get from running in a different way.
Yeah, I have that conversation with people a lot. Just like what is it about running that
Mm-hmm.
totally is different than everything else? Because I mean, as you mentioned, like the cycling, even if you're cycling outside, is it's still not the same. For some people, I think it works, but do you have further thoughts as to like why running's so unique?
I mean, I think this is kind of, I guess, speculation, but I think there is the component of being outside, but I think there's also the sensory input of like feet hitting the ground. There's something about that kind of biofeedback of you're connected with the earth and you're pounding the pavement. Um, your mind, your body is all working as one cohesive unit. So I think there is something unique about that other sports may or may not provide for some people. Like you said, for some people, cycling is a perfectly acceptable transplant
Hmm.
for running, but it's not for everybody.
I hadn't thought about the sensory impact. That actually makes a lot of sense. I'm picturing like a Venn diagram with like running in the middle and like the sensory impact, but like also like actually getting your heart rate up pretty good, and also
Yeah.
like time outside and like being outside.
Yeah.
And I think that there are limited activities that can achieve all of those at once, and it's just not quite the same to get each one of those like individually. But
Yeah. Yeah.
um, I had another question based off of that, but I don't remember what it was. Oh, uh, how can I ask you about like saying the like does it give you joy thing? I loved when you said that. What
Oh, yeah.
is that also related to like
Yeah.
the function?
Yeah. 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 Well, I'm wondering how you could ask it.
Yeah.
Like, I mean, I guess saying what other, you could just say, are there other functions or are there other things you get curious about um, with running with the athletes, maybe?
Yeah. So are there any other functions or things that you get curious about when talking with your athletes?
Yeah, one thing that is really important to me and to find out is, do they derive joy from it? Does it bring them joy? Does it bring them happiness? Is it still serving that function? At one point, maybe it did. Does it still? Um, a lot of times with my eating disorder clients, actually, I will ask, how would you move your body if you couldn't change the shape of your body or the size of your body? And that can give us a lot of information, right? Like if somebody says, "Oh, I would still run," well, then, okay, it has some underlying joy and happiness that it brings you. But if somebody says, "Oh, actually, I hate running," and like, I would never do that, I would only do walks on the beach. Um, that gives me a little bit more information too.
In those situations, do you try to encourage people to maybe find other ways in terms of that fitness, or is it maybe more deep rooted? And yeah, this could bring up a little bit more conversation specifically around eating disorders, but in body image.
Yeah, yeah. I mean, I think that it is, I definitely go deeper into it. And it doesn't have to be an either or, it can be a both and. So I love that, using that in my practice all the time, is oftentimes we, as humans, we like to go into the black and white. This is either I run or I don't run. But what if it's both? What if you run some days because you appreciate the cardiovascular fitness aspect of it and the way that you can connect to things? And maybe there are some other activities that you actually enjoy more, um, but it doesn't have to be either or.
Totally. Could you go deeper in terms of, I guess, like the diagnosis around like disordered eating, and if most people, when they're reaching out to you, do they tend to know that they have that or like issues with that, or is that something they
Mm.
maybe discover on their own? And I'm sure that there's levels to it, right? I'm sure some people it's a smaller thing and other people's it's a much larger thing, but maybe like signs of you might have a eating disorder if this.
Yeah. Yeah. Well, I think the thing that's interesting from having worked in a college counseling center, and I will say with the caveat that the predominant population that I would see there were females. I did have some males, but I always ask the question, regardless of what somebody was presenting with. I would say, how do you feel about food? How do you feel about your body image? How do you feel about your relationship with exercise and those kinds of things? And I would say a good 90 to 95% of people had some degree of, oh, well, I don't love my body all the time, or I struggle with XYZ. So I would say that the majority of people actually come to my practice saying, well, I don't know that I have a full blown eating disorder. I struggle with food or I struggle with perfectionism, but I don't think it's really an eating disorder. And I think that that's a product of our culture, and what's been told, especially for females, but it's actually quite prominent in males as well. It's just not talked about as much, but especially in the athletic community and the running community. Like there's a certain body type that you're supposed to have to look like a runner, or just in our society, there's a certain body shape or size that is more accepted than other body shapes or sizes. And so I find with most people, they've at least thought about it, at least thought about, you know, the relationship that they have with their body, um, and with food and with exercise.
Yeah, I feel like I always I don't talk to my clients about this because I always feel kind of bad and guilty about it, but I feel very fortunate. Like I feel like I haven't ever really struggled with body image too much or disordered eating. But I feel like I very much could have, especially like back in college. And maybe I did a little bit. And like in hindsight, like now talking about it, maybe there was a little bit, but I think I resisted the potential pressures. But there's just especially when you're really like competing, there's so many pressures around that, and like people throwing out like every pound that you're less weight from a performance standpoint, you're running, a couple seconds faster per mile. And then when you do that over 6 miles, it's like that could be the difference between first and fifth.
Yeah.
So I think I had those temptations, and it was mostly because I was, probably 20 pounds heavier than like everyone else on the starting line, being a taller guy, but also just my body build. Um, but I think maybe, are there like certain, I know you work with a lot of youth athletes too. Are there certain like
Hmm.
signs that people, whether the athlete themselves or like parents, are there certain signs that they should really be looking out for that might suggest like, hey, like maybe talking to someone sooner rather than later would be good?
Hmm. Yeah, I mean, I think when we notice rigidity around anything, we want to pay attention to that, whether it's, rigidity around food or certain types of foods, or when foods are had, or rigidity around exercise, and totally, some people will be totally disrupted if exercise can't go as planned. So I think for parents and for young athletes to kind of again pay attention, like, oh, why did I start running, or why did I start doing my sport? And is it still making me happy? Or do I feel the pressure? Do I feel everything building up? Like, oh, I have to eat a certain way to perform a certain way, or I have to run, again, X amount of miles or at this pace all the time. When there becomes these shoulds, that's when we really want to start listening, to like, oh, I shouldn't have this food because, it will cause me to gain weight, or I should do this at workout. I really encourage people to check into the want and need. But for parents, it is tricky because a lot of teens right now are on so much social media that a lot of it might be internal and you don't even see what they're consuming or who they're comparing themselves to. So having open conversations about like, how are you feeling about, your body, or how are you feeling about your relationship with food? They might not open up, but at least you've opened the door.
Is it like early teens that you think that generally starts, or do you think that could be something that's like, as young as like 5, 6 years old?
I mean, unfortunately, we are seeing cases of eating disorders really young now. I did do some work at the Children's Hospital in Denver. Now, that was many, many years ago, but we had patients who were 11 and 12. Now I know of cases of 9, 8, that are starting out in these, like having to go to a children's hospital for the struggle. So I think it is getting younger. And I think that, it can be that somebody is really resilient and, like you said, kind of able to, I'm not sure how you said it, but like resist the pressures of both society or cultural norms, and kind of always achieving, always doing, and it might show up later. But oftentimes there's some seeds planted early on, I think.
What about we've we've been touching on rigidity a decent amount, and I think that that's a really interesting topic in general, not just related to like running and running training.
Mhm.
Do you find that like, is that just like a deep rooted personality trait for somebody, and if they're like pretty rigid in one area like run training, they're probably like that in other areas of their life, or maybe vice versa? Like if someone is very like set schedule type of person, maybe if they're getting into exercise, maybe they should be someone who maybe doesn't get on Strava or log stuff or something like that.
Mhm. I mean, I know they always talk about like personality type A, type B kind of thing. And I think obviously it gears more towards the type A personality to be more rigid. But is that an actual diagnosable thing? No, it's not. Um, I think that neurodiversity obviously contributes to rigidity. And so that can be things like, even though it seems confusing, but ADHD, autism spectrum, but also anxiety and those kinds like mental health neurodiversity, those kinds of diagnoses can also lead to rigidity. Because when you think about from the anxiety perspective, um, if everything feels a little like a threat, then you want to minimize threat. So how do you minimize threat? Oh, I keep a structure. I keep a schedule. Then everything's predictable and I don't have to worry about the anxiety as much. So I eat on this schedule, or I work out on this schedule, or I open my mail on this schedule kind of thing. I pay my bills on this schedule. That can feel a little bit more safe than everything being up in the air and disorganized.
Do you think that that's potentially like someone's way of just like not dealing with like the root cause of feeling like they need to be like that, or do you think that that's just like normal for some people and it's just like okay and you don't need to like necessarily try to find the solution to feeling like you need that much structure?
This is such a typical psychologist response, but I think it depends. um, really, like for some people, I mean, we've shown that there's just different brain patterns for certain people, and so that is just like an innate thing that is going on with their lives and how they function in the world. For some people, anxiety stems from experiences that they've made meaning of, um, that then they develop anxiety around it. So it could be a traumatic experience. I say capital T, like a trauma that other people would think is traumatic, but it can also be a lowercase t, where somebody from the outside might not think of it as traumatic, but to that person, it was unexpected and jarring. And so they might develop some rigidity to try and prevent something like that happening again. Um, so, yeah, I think it depends. But if it
Yeah,
is more of a character trait than a character state, either way, we can find ways to manage it and to have it not be as impactful on somebody's life in terms of a negative impact.
I like that character trait versus character state, meaning
Hmm.
something that's just like how someone is versus like maybe in a given moment or a given situation they
Yeah,
might act that way.
yeah, exactly.
Do you so in the category of someone is struggling with rigidity, whether with um, around exercise, would you also call that exercise compulsion, or would you say that that's different?
It depends on the severity of it. So for something really to be a compulsion, when we think of OCD traits, obsession, compulsion, what happens if they don't do it? What are they avoiding by continuing to exercise in the way that they do? Um, they again can be characteristics of the diagnosis, but not necessarily meet all criteria for an obsessive compulsive disorder. But I think colloquially, is the word, um, that we kind of throw out compulsion, in a much more less clinical aspect,
Mm.
I guess, or a less clinical way of talking about it.
With with someone that you feel like it's helpful for them to work on being more flexible, whether with run training or just other areas of their life. Are there certain strategies or like main things that you try to like dig into to help work on that?
Hmm.
I'm assuming it's a very long process, and that's like probably why doing therapy would be helpful in those situations. But
Yeah, absolutely. It is. I mean, first we have to have buy-in. Like, does the person actually feel motivated to do this? Because if they don't, me telling them like, hey, you should have less rigidity around something, that's not gonna, they're not gonna, they'll be like, all right, and then not do it, which I'm sure is the case with your patients as well. Of, if somebody doesn't feel motivated to keep up with their exercises at home, then they're not going to.
Mhm.
Um, so that's the first step is, do we have buy-in? And it might not be 100% buy-in. It might be some days it annoys me that I have to run this much, but some days it doesn't. So it's like, okay, on the days where you are feeling a little more motivated, what can we do to have some more flexibility? And then we're going to notice the discomfort that comes up when you try and initiate that flexibility. Because again, your safety zone, your safety net was the rigidity. So if you try and say, let's be flexible, if it were that easy, you would have done that already. So it's going to be uncomfortable. Let's notice those feelings. Let's sit with those feelings. Sometimes we can even do like an imagined exposure in the session of, okay, you're going to go and you're not going to do it this way. What comes up for you? And oftentimes people will be like, oh, I notice my chest gets tight, or like my stomach feels a little queasy, or I'm tensing my shoulders. Okay, that's your body giving you cues that it doesn't really want to do this. And how do you and I work through this together right now so we can dissipate those feelings, so we can breathe through them, so we can distract it, so we can kind of notice where they are, but not judge them. Then when they get out in the real world, they have some tools to apply that.
Do you find that, obviously not always, but sometimes people are able to just through like habituation and like more exposure, like I guess improve in that area?
Yeah,
Yeah.
absolutely. That definitely. I mean, the kind of gold standard for most compulsions is exposure
Mhm. Yeah, that makes sense. And I'd
with
imagine that,
with support, right?
yeah, yeah. I was gonna say, I'd imagine that like having that support is hugely beneficial because if someone didn't need the support, they, like you said, they probably would have done it on their own already and not be still struggling with it. And I really like um, the imagination of it, like in person, so that you like literally be there, like when it happens, and like help them like
hmm
work through those feelings for sure. That's great. Um, do you have any other thoughts or things that you feel like would be helpful to add around rigidity?
Um, I mean, I guess the only other thing to kind of think about is with running, there's a lot we can control. There's also a lot we can't control. And so sometimes I see some rigidity around, or just in terms of trying to control something. A great example of this is race day weather. And so people, the week leading up to Boston Marathon, checking their weather app over and over and the temperatures are gonna be warmer. Oh, okay. Oh, maybe there's a 15% chance of rain. Like, we can't control the weather, and that feels uncomfortable. And especially for a big race like a marathon where you've done so much training leading up to it, that part can feel really hard to tolerate. Oh, the conditions might not be ideal for what you were hoping for in this moment. And how do we then reframe? I'm still getting to do this. My time might be a little bit slower than I expected because of the conditions. And like, how can I still find joy in it? How can I find gratitude for what I'm getting to do?
That just brings up a topic that I feel like I've really been trying to work on personally in the last year or two.
Uh-huh.
And something I feel like I innately was working on it, like since graduating college 10 years ago competitively with running, and like then still trying to compete, but not as seriously. Um, just the process of going from, and not necessarily just for people who like maybe ran in high school or college competitively, but people just with running in general, trying to go potentially from running for outcomes to like running for like doing it for the process. And I guess not just running in general. I feel like you could do that for anything. I think that there's a nice balance, but for like being goal driven, but then also like trying to enjoy the process of reaching for those goals. But um, do you have any thoughts around process oriented goals versus like outcome oriented?
Yeah, I think I'm right there with you. And, obviously competing at a high level, that's something that I think about too. It's funny, I actually listened to a podcast with Kira D'Amato last year. I don't remember who it was with, but she talked about finding joy in running and like why does she run and like smiling and having fun with it and their family traditions around that. And so to me, that actually sparked a really good internal conversation of like, oh yeah, like this is fun. Like have fun with it. You don't have to hit a PR every time. And so I think that just again reconnecting with why you do it, finding that function that can remind you of the process as well. But I think for goal-oriented people, there's always going to be a component of that. But maybe we reframe what the goals are. Like my goal is to, you know, smile at the race photographers, or like try and just mix it up a little bit as to what your goal is for the race. That it doesn't have to be necessarily a time.
Hmm. Yeah, maybe still having a time goal, but having more than just a time goal.
Oh, totally. Yeah. Like, I mean, I would be lying if I said I didn't have time goals every time I toe the line. Um, so that would, but I think what are your other things that you can also hold on to?
Hmm. I feel like I've with both friends, but then also like clients, I've definitely noticed that there's a very large difficulty for a lot of people to go from competitively running in, say, college to like not running competitively anymore. Um, and maybe it is when they leave college because they don't have like the team environment, and that helps them kind of like stay consistent and do the races because they're on the schedule, and they don't then
Hmm.
prioritize that. But also, I think too, maybe even more common is um, people getting older, getting more injuries stacking up, and then
Yeah.
kind of like altogether, being done with running entirely because
Hmm.
maybe they can still run 20 miles per week without like being chronically injured, but to do the performance goals that they had, which they used to be running 60, 70, 80 miles per week, they almost just don't I don't know, accept that. But
Yeah.
I don't know if you have any thoughts. I
Yeah.
wasn't turning that into a question
Yeah.
necessarily, but
No,
talking about.
but it's funny as you were saying that before you even got to the like 80 to 20 comparison, what came up for me was kind of the all or nothing thinking
Mm,
of it can be really hard to find gray area and go, to go from being a competitive athlete in college to maybe a less competitive athlete. Like that feels a lot like a lot of gray area for people. And again, as humans, like we like black and white, we like structure. And so it can feel like, oh, well, if I'm not this high level athlete, then I don't even want to show up at a race. I don't even want to run because what's the point, Um, or egos can become involved of like, I don't want my name associated with that time. Um, so it definitely it can be hard, and that kind of thinking can also show up in people who haven't necessarily even been at a high level, but oh, I only have time to run 3 miles today instead of my usual 8, so I'm just not going to run today,
mm,
right? Because 3 miles doesn't count. And it's like, oh well, but 3 miles are some, or running some races if you have fun with your family or your friends, isn't that something? Even if you're not, the one crossing the tape or
mm.
breaking through the tape.
We see that a lot with people after like having to take time off from an injury, especially like stress fractures. But
Yeah.
is like I think 3 miles is usually the exact number that people say. It's like anything less than 3 miles, it's pointless for me to even go do it. So I'm not going to do it. Like, why would I go do like, 2 by 5 minute jog or like 5 by 1 minute jog, or like when we're just starting off.
Yeah.
I think most of the time when people are in the situation of like recovering from stress fracture, they know that it's a little bit more serious and that they do have to do some form of like walk jog as part of their return to run. But maybe the best example is when it isn't a stress fracture, but it's still a pretty serious like overuse injury. Um,
Hmm.
and they might take 1 to 4 weeks off while we're like kind of doing some initial rehab, and then they're like, all right, I can run now, and all right, 30 minutes, and it's like, oh, it's so
Right.
painful again. It's all or nothing. Yeah.
Yeah. Yeah.
um, can you can we go back to the convo around neurodiversity? Can you
Yeah.
maybe expand on just that topic, in case people aren't familiar with it? I feel like someone who is um, maybe neurotypical, I think is the
Hmm.
term,
Yep.
might not know as much around it, but or someone who maybe has never heard the term as well.
Yeah. Yeah. So neurodiversity really just refers to the fact that our how our brains function are really kind of on a continuum. And so the more neurotypical brains, not struggling with mental health or attentional difficulties or executive function difficulties or social difficulties. But as we move down the continuum, then you're going to see things like anxiety and even depression and some of the bipolar. So, brain functioning that's slightly different than what we call the norm. But what's funny is that actually neurodiversity makes up more of the population than a neurotypical person who has zero mental health issues or zero, executive functioning or cognitive challenges. So it's funny that we call it that because it's not actually accurate, but it can range to something as very significant as an autism spectrum disorder is also a spectrum, but something more significant where somebody has some limitations in terms of their executive functioning, their global functioning, being able to take care of themselves, and those kinds of things. So it's a whole range of just how our brains function in the world. And over time, some of it is really has been adaptive for our environment and over adaptive in some other ways. So I always talk about anxiety as an example. In our like hunter gatherer days, being aware that there's somebody over there who you don't know who could be going to harm you is really important. Or seeing a bear and having some fear and not like hanging out in that area anymore, super important. Now, our anxiety is maybe seeing a bear, but it's actually a rock, right? So it's become overdeveloped. And it once served a really great function to keep us alive, but now maybe it's kind of hindering our development in some ways.
Yeah, that's so interesting. I do like to play that game sometimes when I think of it is like what yeah, what was the purpose of whatever this thing is, in terms of
Uh-huh.
being being a person? What was its
Right.
purpose today? That's interesting. It also makes me think too. Just, I mean, obviously, I don't really know, not having lived then, but if there could, if that could be a potential like root cause or a stem of like gender differences in terms of like mental health as well, just with you know um, I'm assuming the the women would be more of the gatherers or like be with like the children
Hmm.
and that type of stuff, and like it would make sense at that time to maybe be more like alert and have
Yeah.
more of that innate maybe anxiety for a good thing. And then like potentially does that, I know tons of men like obviously also struggle with anxiety, but I wonder if if there's any correlation with that. I don't know if you have any thoughts around.
Yeah,
around.
no, I love it. I mean, I'm sure there's some sociologist out there who has
Yeah.
delved into this topic, but so I can't speak to it. But I love where I am on board with your thinking and your thought process. I think that makes a lot of sense.
I think how how much time do you feel like you talk with people around um, helping them know that they're not alone, and that it is kind of probably, as you said, like more common for people to struggle than to not be struggling. Um, and are there, I'm thinking like support groups that you recommend for certain like potential mental challenges or diagnoses that people have. I guess we also started a recent support group with you, which we're
Mhm.
super excited about, so we can dig into that as well. But I guess first, do you have any standard suggestions or conversations that you have with people around that?
Yeah, I mean, I think just engaging in therapy with me, oftentimes, like the feedback that I get from a lot of people when they reach out is, oh, I read your website and you were speaking right to me, or I identified with something that you said. And I think that is so helpful in and of itself, just to feel like, oh, somebody gets it, somebody understands what I'm experiencing right now. And I do some discussions around like this is a common experience of people. And again, just normalizing and validating whoever is having whatever experience. And then as far as group support, groups are phenomenal. Like I have always believed heavily in groups, and again, the research supports their efficacy. And so I was super excited to do the group with you all because even from our first meeting, I think a lot of people got a lot of support out of it and feel seen and feel validated. And one thing that kind of comes up is for especially in this kind of the running group, for example, one thing that came up is people who are not runners don't get it. And so, being in a like-minded group, it really does feel helpful to be supported. Um, so that's fantastic. It's kind of a novel, not novel, but unique thing that you're offering in this area, at least. I don't know of any other that are being offered. When it comes to group support for like my eating disorder clients, there are some online groups that I'll recommend. Um, and sometimes people need higher levels of care, and higher levels of care do always have group support. So anytime somebody goes to a partial hospitalization program or an intensive outpatient program, those are always group formats, as well as individual therapy.
That is something I wanted to ask you about. Is when when someone might, if they're considering reaching out to you, but really what they need is a higher level of care. Um, they probably don't usually know that in the beginning. Would probably
Mhm.
still talking to someone like you be the first initial step?
Usually it is. And the with most eating disorders, so I should say there is a difference between kind of having disordered eating patterns and a diagnosable eating disorder. So disordered eating patterns might be kind of some yo-yo dieting, or relationship with food that just feels uncomfortable and unhealthy. Versus an eating disorder where somebody might be engaging in binging and purging or severely restricting. And I always say this, that struggles with food are valid no matter what degree they are, because people oftentimes will come and say like, well, mine isn't very bad, so I don't need to address this really. It's like, well, but is it causing you discomfort? Then let's address it. Right? It doesn't matter if your best friend or someone you saw on TV is struggling more. I'm not worried about them if I'm not treating them, right? I am worried about you and your functioning. Um, so, anyways, long story to get back to. if somebody presents with some of those more, uh, I want to say like detrimental behaviors such as binging and purging or restricting and weight loss, I'm working with their doctor as well. So I get a release of information and we're talking and we're getting labs drawn and we're checking on weight and we're checking on, just orthostatic blood pressure. And that's going from sitting to standing for people who don't know and seeing how the body responds to those kinds of stresses. If somebody is popping as like, oh, they're not appropriate for an outpatient level of care, then we can have discussions about moving into a higher level of care. And I'm happy to provide referrals. Oftentimes, I have people going out of state. If I'm seeing them in Maine, obviously, if I'm seeing them elsewhere, then there might be facilities who are closer to home for them. Um, and and or if it's really disruptive to their lives. So even if their labs are fine, their doctor says your health looks fine, but they're like, I cannot stop this. I cannot make any dent in my behaviors or make changes. Then we also might talk about higher level of care because again, it's having the groups 3 times a week and having the dietitian on board and having the therapist all in one spot can be really beneficial.
How often do you feel like you're having to make that recommendation?
Um, you know, honestly, it's not super often in terms of a percentage wise, maybe like 10%,
Hmm.
15% my clients.
Yeah.
Um,
I, I'm sure a lot
yeah,
of
yeah,
I'm sure a lot of times people don't even make it to you if they're like first going to their doctor and then they just get directly sent. I'm assuming too.
right. Yeah,
Yeah,
yeah, yeah.
yeah. That's yeah, it's tough.
Yeah, and
Um,
it's honestly, I feel like a lot of teens are who
hmm,
I'm talking about higher level of care.
hmm, interesting. Is Why do you think that is?
I knew you were going to ask me that. I was like, why do I think that is? Um, uh, you know, I think it, so this is in no way saying parents are to blame, but if the eating disorder is a function of trying to survive in a certain environment, and it could be school, it could be the pressures of school or friend groups or things like that, but it could also be the home life. It is really hard in that environment to remove the behaviors because eating disorders really are just a way of coping. A lot of times people are like, I don't understand why somebody like restricts their food or somebody binges and purges. It's a way of coping. It's a maladaptive way of coping, but it is a way of coping with something. And so in the environment in which those behaviors felt necessary, it can be harder to take away the eating disorder
Do you
without
think
building a significant replacement.
I'm assuming that's related to like the control conversation we were having earlier too? Um, do you want to maybe just touch more on that? I'm imagining like someone who is maybe a full on adult has
Mm-hmm.
a lot more control in their life. Doesn't mean that they can't struggle with that too, for sure. But maybe that's like a big part of it for younger people who maybe have a lot less control because of their home life and school.
Yeah. Yeah. I think that that's a huge component. I mean, agency is a really big part of eating disorders, feeling like you have control. And sometimes it's things, I have moms who, in theory, have control of their lives, so to speak. but feel so chaotic, feel so out of control, putting their kids' needs before their own needs. And so the eating disorder kind of comes in to rescue, so to speak. This is going to help you. So I think, yeah, with teens, a lot of it is, I mean, there's so much changing hormonally and socially in teens right now too, without even the, cultural and family and school aspects of things, that there's a lot going on. And so, yeah, if that feels out of your control, you might want to dig into something that feels like you can control it. Like, I'm going to not eat this type of food. And again, with that cultural acceptance piece, you know, diets are talked about all the time. So it's very culturally acceptable to say, oh, I'm going to cut out this food group, or I'm going to go on this diet.
Yeah, without like knowing how that affects you or could
Hmm.
affect you. Um,
Yeah.
I'm curious if you see many new moms. Being a relatively new parent, our son's about a year and a half. I could totally
Hmm.
see how potentially maybe someone has never fully struggled with like a mental issue because they were able to kind of manage on their own. It was kind of just them or them and their partner, but then having to manage another life. I could just
Hmm.
see that being like a very common time that people then like start having something that maybe was more underlying come to the surface.
Absolutely.
Do you see that a lot?
I do. I do. And I love working with new parents and new moms, because obviously, as a mom myself, like, again, it's something that I can relate to. And I feel like, again, feeling seen and feeling heard in that way of somebody who gets it is very important. And yes, I mean, there's also postpartum anxiety and depression with the hormonal changes. And so, of course, those kind of come up often. But also, like you said, just managing a different structure and schedule, like what was working before is going to be thrown on its head. And so, if you did like structure and schedule before, a baby's going to throw all of that out the window. Just when you think you've got it down, they hit a new milestone and something is different. And when you think you figured out one, then your second comes along if you have a second, and you have no idea what you're doing again. So it's great. Parenting is great. Highly recommend.
You have three, right?
Yes, we have three.
What are their ages?
And they're all so drastically different.
Yeah.
One just turned 10, one is going to be turning 6 this summer, and one just turned 2. So
Mm.
got the whole spread.
Because I was also thinking like, how much does like the gap play into it for people? I feel like
Mhm.
I think a larger gap is hard, but also a smaller gap is hard. Um, but I'm assuming probably a smaller gap is the hardest. Just yeah,
I personally, having done the larger gap of 4 years, I would assume that the smaller gap is, don't get me wrong, like the larger gaps has its challenges too, but I never have had overlapping diapers or people who couldn't walk, while the other one couldn't walk. So, um, yeah, I do think I have a lot of respect for the 2 under 2 crowd and, people who have them closer together.
yeah. I think we'll wrap up here pretty soon, but I did have one more
Yeah.
follow up question around like the parenting topic. Um,
Hmm.
I don't know how common this is, but I'd imagine it would be relatively common. But if there are um, potential parents out there that are maybe nervous about starting a family because of um, their own anxieties or mental challenges, um, do you have specific recommendations around that? And also, I guess too, I'm assuming that it usually probably is something that just usually is harder and potentially has the potential to get worse after the baby arrives. But would you say that that's like always the case? And I guess my thought would be like, if you're not doing therapy beforehand, like starting therapy beforehand, would be the most helpful thing to make sure you have things under control yourself before like having the kiddo. But I'm curious if you have further thoughts on that.
Yeah, I mean, I would say I wouldn't jump to saying it always gets worse. Um, it can, maybe if it's left unchecked or if somebody doesn't have a lot of insight or a handle on what is going on for them. There are phenomenal perinatal providers in the area and across the country, but people who work with people through pregnancy to kind of talk through the fears, the challenges, and can even support post-birth as well. But there is a whole subsection of therapists who specialize in just that, making sure that the parent is supported through their pregnancy and talking about any concerns that they have in terms of, because a lot of there are medications that some people are on but then can't be on it when they're pregnant, and so again, just wanting to make sure you have a team in place to support you as you go through those changes.
We've kind of had we've had multiple people who like knew they wanted to get pregnant, but they were struggling with an injury, and they also knew that they wanted to be active through the pregnancy. So they'll like reach out
Mm,
to us and be like, "I really want to get pregnant, but not until I can run more." So I'd imagine,
interesting.
yeah, I'd imagine it's could or should be a similar thought process. Obviously, it's not
Hmm.
always planned either. So, uh,
Right, right.
but
Yeah, I say prevention. What do they say? Prevention is the key to success. I don't know. There's some saying about that, but like having forethought and preventative things in place, if you are planning to have a family and you're like, oh, there's some things I want to work through, um, around body image, I find that a lot with females in particular is like, I don't want to pass this along. My mom did diets. My mom talked negatively about her body. I don't want to pass that along to my kids. So how do I heal my relationship with food? Um, and I think that I love that one, somebody has that insight, and two, it's thinking about how do I show up in a way that is going to be, both beneficial for me, but also for my kid.
hmm, totally, yeah. Um, I want to be respectful of your time. I think that this has been super great conversation, and I honestly feel like could probably do like a 10-hour episode. So I think we'll have to do another one in the future for sure.
Yeah, for sure. I
Um,
would love that.
yeah. Do you have anything else that you want to add based on our conversation? I mean, to repeat where people can find you, I'm assuming your website's the best place.
Yeah, website is great. That's probably the best way. You can reach out to me on there. It has a link to my email. My email is just dralexiswilbert@gmail.com. That's the best way to get in touch with me. I think the only thing that I didn't mention that just to like put out there is um, just to be mindful as we talked about that relationship with running of um, I think sometimes people might be unaware of how their relationship with food and running might be intertwined. And so to just check in on it, like I just ask people to be curious about it. Like, oh, do I feel like I can eat more when I run? Or do I feel like I need to restrict on my rest days and things like that? Because it can be really, really sneaky, I think. And some people are like, oh, I had no idea that I had that thought process because I've been running. And then they get injured, and then that's kind of when it comes up. So even if you're not injured and listening to this, I say just be curious. And that's kind of a gold nugget that I throw out to everybody. Be curious.
Hmm.
Not critical, just curious.
I think just, I mean, part of the reason we've been so excited to be connecting with you more is just how the more that we do work with runners with injuries, the more we find that the psychological component is so big for so many people.
Yeah.
I think I've told you before, like I was like, I wish I was also a psychologist. It's just like
Yeah.
I don't need more schooling at this point.
Too many
But
hats.
yeah, yeah. So I mean, but I think even if that was the case, like I think that would be too many hats. And I think it's better to have a collaborative team. But I think
Yeah.
what a lot of times people struggle with is they've worked with healthcare providers before. Maybe it was a healthcare provider, but I usually blame it on the system that the healthcare provider was
Mm,
working in, and they didn't connect with the person, or the appointments are set up so they only have 5 or 10 minutes.
right.
And I think a lot of times people are what do I call it? I call it like healthcare fatigue or something like that, and they just
Mm,
like they're
yep.
kind of sick of meeting new people, talking to new people, telling their story a bunch of times, and like not fully relating with somebody. But I think that that's kind of what drives what we're doing, and also why we love what you're doing too, because it's a very similar model, and you're able to truly connect with people. And as we've talked about, like being a runner yourself, I think no matter what, that always makes you better able to understand what people are going through. Um, so I've honestly been kind of talking to people recently, like asking, do you have a therapist? And they'll say yes or no. But if they say yes, if it feels to me like maybe it's not as helpful as it could be, I will challenge them a
Mm.
little bit in a nice way,
Ah,
and just like I think people get so connected to somebody, and it makes sense. And it's like nothing bad about your therapist. Does your therapist run? Are they a runner? And
uh-huh.
I've had multiple people recently be like, no, and my issues are like very running related, and I'm like,
Oh, interesting. Yeah.
I think you should talk with Alexis.
Uh, well, I appreciate the referrals. Yeah, and with that being said, I won't be the best fit for everybody, and it is important that somebody finds somebody that they feel like is a good fit for them. So, um, I'm always happy to. I offer a free consultation to have somebody kind of chat with me and see if we would be a good fit, and uh, I'm always happy to refer out if it ends up not being a good fit.
I think that's always the best sign of a great provider is knowing when you can't help people, and that's why we do that too. We do a 15-20
Yeah,
minute initial call with people, and most of the time I feel like people are a good fit, but definitely not always.
right.
But so that's your first step. So someone can schedule that on your website, and then you have like an initial like kind of informational gathering session. Is that right?
Yeah, yep,
Yep.
yeah. So I do an intake session and get a broad history. And I always tell people, like, I'm going to be asking you questions that sometimes you might not think is relevant to why you're coming in, but I do try and there's a method to my madness, so to speak. Like, I'm trying to get a broad picture of who you are so we can pull at different threads to find out, where we can find improvement in whatever you're presenting with, and best support you.
Mm-hmm. Do you always have people do like a bunch of like forms or like outcome measures beforehand, questionnaires? I could see that being very helpful for you, but also sometimes maybe a barrier for some people that don't want to like do tons of
Yeah.
work beforehand.
Yeah, I mean, most of my paperwork is just paperwork for like consent to treat and all of that. I might throw a couple of outcome measures, especially if they're presenting with an eating disorder. We'll just kind of get a sense of it. It's like a 30-second to a minute questionnaire. So they're not long outcome measures, and it's really just to kind of get a baseline of where we're starting and kind of see where things go.
Not having people take a bunch of personality tests right off the bat.
No, no.
I had one of my first jobs. I had part of the interview process was taking like 3 personality tests, and I also knew I wasn't
Oh,
gonna like work
wow.
there, so I was there for like an hour filling out these tests, and I was like, I'm not
Oh
even
my
gonna
gosh.
get this position. But anyway,
Yeah, no, no, no fun. No, I don't have
yeah,
any of that.
that's good.
Yeah.
Well, all right. Yeah. Anything else to add?
No, I mean, just another plug for the group that
Yes.
you all are offering, that it's, I think, such a great resource for the community. Obviously, a little biased since I'm helping run it, but also just really feel like it's a great space. So
Yeah.
thank you
No.
for offering it. It's
Yeah. I'm.
fantastic.
I mean, helping run it. You are running it. It's just at our space, and
Yeah.
we're trying
Yeah.
to help promote it. But yeah, I did want to actually mention that. So if someone is listening, so the group size is 3 to 8 people, right?
Yeah. Yeah.
Three. And it's a monthly session. We're running it. as 3 minimum to happen, just so it's that you get the benefit of having the group, but then 8 maximum, so that I think the idea is so that everyone can fully participate and share.
Yeah.
And is there much structure to it? Do you want to touch on that, or is it pretty open?
It's pretty open, depending on, the kind of makeup of the group. If it's people who have, we met last time and it's all the same people, we might kind of broach some different topics, but it's really what the group feels like they need in that moment and the people feel like they need, but making sure everybody gets some airtime, so that they can get their needs met. And I do usually start out with introductions and why are you here and what are you hoping to get out of today, and go from there.
I know last time was the first one, and Asher and I weren't in the group, so we don't know how it went, but we knew some of the people, and it seemed like a pretty broad range of people, with some with injuries, some not necessarily with injuries. But I think, as we talked about earlier, that support from a group is so huge. And I know we see that because we're talking to people every single day, and we're like, oh, so many people have the same issue. And
Uh-huh.
that's kind of what like stemmed the idea. Is like, I wish all these people could just talk openly about this together. So
Yeah.
we're super appreciative that you were open to it.
Yeah, absolutely. I was really excited when you guys approached me about it. So,
Well, I think that this will air probably. It'll be a little bit before it airs from when we're recording this, but we'll have the dates and like information for the upcoming group sessions in the show notes for
perfect.
people to learn more. But and also your information and anything pertinent that we talked about today. But
Awesome.
thank you so much again for joining me for this. I think a lot of people will really connect with this, and this is another way for people to realize like, oh wow, like a lot of people do have similar struggles that I do, and I think that that's a huge part of it for people. So thank you so much.
Yeah, thanks for having me. This was so great.
Yeah.